So sorry for the delay. First off, I'd like to just introduce myself and the team. My name is Peter. This is Jose and Veronica. We are unfortunately missing one member of the team. He's a general practitioner, a physician, and has obligation to his patients, so he couldn't be here today. But we'll continue without him. So together we are Bionanosense. We're here today to present to you an amazing new nanosensor which has the potential to transform the way we practice medicine, and also has great application further in sensing the food and the environment around us. Why we want to focus on the medical market first with this sensor? It's a huge market with global medical device sales estimated to be around 400 billion in 2017, and the sensor market itself estimated at $15 billion by 2022. So if Thierry were here, he would say that what he sees in his practice, he sees an ever-increasing amount of patients who are waiting longer and longer times for diagnosis. He would say he's seeing increasing costs in healthcare, and healthcare now becoming ever more centralized. So what he needs in his practice is a low-cost diagnostic test that is easy to use. He can get the results quickly. He and the patient can both be done quickly, and the patient can go home instead of spending long times in the waiting rooms, possibly getting infected by other patients and so on, which all increases health care costs. So what our solution that we are proposing is and developing is a sensitive, specific, very specific, quick to diagnosis, versatile, easy to use, and very accessible bionanosensor, which has the potential to lower healthcare costs and change the way medicine is practiced. To explain a little further on the technology of the sensor itself, it's based on molybdenum nanowires, which are coupled to antibodies, and in a pretty simple electrochemical reaction allow the sensitive and quite specific detection of disease markers and pathogen markers. Our group and some other groups have also published a couple of papers on the characterizing the nanowire and antibody coupling, as well as the working of the sensor. But we don't just want to stop at the sensor. We want to integrate that data further. We want to capture the data coming from the sensor and provide it for the doctor to be able to track his patient over time, when even through health, and then when disease starts. We want to make the data available for the doctor to be able to look at his patient database and population, as well as look at the hospital level, the regional level, or the national level, to be able to analyze the epidemiology and create more effective preventive measures. Through connections like Genubila, we'd also like to provide this data in an anonymized, private way to researchers to be able to integrate further and analyze further. So our business model basically is based on the patent. We want to patent the technology as soon as possible. We also want to manufacture the chip itself. So this would provide a highly valuable diagnostic tool and data to government healthcare providers and social security providers, as well as hospitals themselves. We propose the revenue to be a one-time device sale to one doctor, of course, and repetitive chip sales. The chips themselves enable modularity, so you could have an infectious disease module, you could have a cardiovascular module, etc. We propose a pilot test at the beginning, which would involve the two hospitals. We're choosing hepatitis B sensor first because healthcare workers need regularly checks for hepatitis B, so at least once a year. So we would be able to test our platform on healthy individuals and see how it really does in a hospital environment. We're proposing to do that through 10 devices and 10,000 chips. The sales and marketing itself will be done on quite a direct basis. Myself and Thierry are both doctors, and we sort of have connections in the healthcare system. We would market our device directly to healthcare providers as well as hospitals. Also attend medical conferences, present our device, and publish advertise in journals. But we also want to integrate social media. We want social media accounts to be able to involve the patients to basically know there's an alternative out there and demand it from their healthcare providers, so they spend less time in the office, in the doctor's office. Of course, this being the medical field, there are competitors. There are quite similar competitors. Our main competitor would be Bionanosense, which is a company based in Stanford, which is developing a sensor also based on nanotechnology. It's based on carbon nanotubes, which are more difficult to produce or to make a sensor out of. It's a more complex platform, and thus has a higher cost of the instrument itself and a higher development cost. Our sensor is based on quite a simple architecture, so the cost is lower. We also have very high versatility. We would also be competing with hospital labs, but which are quite expensive and require lab personnel and lab equipment. And the tests themselves can take a long time, sometimes take a long time. The other alternatives are also like stuff like the influenza diagnostic test and the rapid strep test, which are also our competitors. To introduce our team a little bit further, myself and Thierry, as I said, are doctors. Jose is our specialist in biotech computing. Veronica is a molecular biologist. We would also be looking into hiring an electrical engineer to develop the hardware and software, as well as the physicist to collaborate in the further development of the nanowires and the whole project. When production starts, we would also be hiring support staff to operate the production. This is the timeline we've envisioned with the sales. So we envisioned 2 years of development for the sensor to get the sensor patented, to get it certified with the regulatory bodies, and the pilot study starting after the second year with the involvement of 2 hospitals and roughly 10,000 chips, and later expanding to more hospitals, as well as developing new sensor applications. As I said, maybe more emergency situation centers like troponin, high sensitivity troponin, to basically detect ischemia before myocardial infarction happens. Of course, for this we need money. As I said, in the first year we want to show proof of concept and file a patent, which is quite expensive. We also would need to purchase lab equipment and start development of the sensor itself. In the second year we'd start production. So in the third year we would start testing in the medical environment. As I said, 2 pilot studies on 1 pilot study of 2 hospitals. We would also be developing further applications. For this, we estimate we need around $4 million to be distributed throughout the year, throughout the 4 years. So basically, in conclusion, we are confident our product is an excellent alternative to other products on the market, and we think we can transform the medical sector, as well as have further potential in food quality sensing and the environmental sensing. So for any further questions or comments, we are very open. If you have any questions, please email us. We'll be glad to respond. Thank you.